from the station that's on your side. This is Channel 7 News at 10.
Good evening. This week marks 10 months since the first COVID-19 case arrived in our state. An alarming number starts us off tonight. 40 more Arkansans have lost their lives to this virus. Tonight, the governor is urging everyone to do their part to contribute to a healthy Arkansas. Here's a closer look at the numbers. We're up to more than 18,000 active cases, with more than 1,500 new cases today. And tonight, 1,076 of our fellow Arkansans are in the hospital. Our hospitals and healthcare workers are feeling the effects of this unrelenting pandemic, and they need help. The Arkansas CARES Act Steering Committee just approved $30 million for hospitals. Tonight, Channel 7's Mills Hayes tells us what they need the most.
As COVID-19 cases surge here in Arkansas, hospitals are in need of resources. Take, for example, back at the beginning of the pandemic, they were in need of PPE, but now those needs have changed.
Right now is a critical moment for the entire healthcare system in the state of Arkansas, and we have critical needs.
UAMS Chancellor Cam Patterson says the $30 million to hospitals recently approved by the Arkansas CARES Act Steering Committee was much needed.
There are a lot of trickle-down consequences to COVID-19.
He says they recently opened up 12 new ICU beds and have the capacity to open up 35 more. But it's the staff that completes the ICU beds.
We're really struggling to support and find the staff that we need to make sure that patients who are in those beds are well taken care of.
Something that CEO and president of Baptist Health Hospitals, Troy Wells, knows all too well.
COVID-19 didn't create this staffing dilemma that we have today.
Wells says Baptist has had to use outside agencies to hire travel nurses, but Arkansas needs to be competitive with pay or the state could lose nurses to the highest bidder.
We have our full-time staff that works alongside traveling nurses and maybe making a lot more money, so we want to try and make sure we're paying our staff, our full-time staff, a competitive rate to make sure they know they're valued.
Patterson says the staffing shortage causes other problems too.
If the nursing homes become filled or don't have staff, we can't get the patients out of the hospital so that we can free up beds for sicker people.
But a lack of staff isn't the only issues hitting hospitals.
Last weekend here at UAMS, we ran out of capacity in our morgue.
Patterson is the chairman of the Resources Committee on Governor Hutchinson's Winter COVID-19 Task Force, and he says that this week they plan to hear from the Arkansas Emergency Management Division about how they plan to tackle that issue of more capacity being at their limit. Back to you.
Okay. Thank you, Mills. This $30 million is on top of the federal CARES Act money hospitals have also received. Baptist Health tells us they have also used the money to buy more ventilators and create more negative airflow rooms.